They had a room full of politicians, people from the insurance industry, and people from the pharmaceutical industry. And the politicians drafted it. There was other people signed off on it. Nobody was in the conversation who took care of patients for a living. Hello and welcome to this edition of the Wise Medical Minute. I'm speaking with you today on what, figuratively speaking, is probably the eve of the demise of the Affordable Care Act. So-called Obamacare is probably, by virtue of one reality or another, on its way out. I think we need to understand what it was intended to be, and what it has become, and what it's about to be in its demise. The Affordable Care Act was passed as a way to create a source of insurance for a lot of people who were uninsured. The mechanism behind the Affordable Care Act had to do with forcing insurance companies to cover everybody, number one. Number two, it had so-called mandates that made everybody have to pay if you didn't buy insurance. So the net result of the Affordable Care Act was everybody either had to pay a tax, and yes, it was a tax, or they had to buy this insurance, or they had to buy some other private health insurance, or they had to be covered by Medicare or Medicaid. Now, for people who couldn't afford the private insurance, they basically expanded the Medicaid coverage under the Affordable Care Act in at least some states. Now, not every state embraced that expansion of Medicaid, which was one of the weaknesses of the Affordable Care Act. Now, I've never been a fan of government-sponsored anything, and certainly not government-sponsored insurance for health coverage. I spent literally decades of my life being opposed to the whole idea. However, after the recent couple of decades of so-called managed care, with the HMOs and the PPOs and all the other things that have been created by the insurance industry, I think I've had to reverse my position on the government-sponsored program idea. Now, the idea was better than the implementation. And similarly, what we have to realize is private insurance isn't even insurance. It's a scam, and I don't mind saying that without hesitation, and scam's a four-letter word. But the concept of insurance means that the person who provides the insurance somehow is indemnifying you for whatever goes wrong. But that's not what you have when you have a health care plan. And if you read those three words in whatever you think is an insurance policy, you don't have an insurance policy. You have a health care plan. So what you have is what some businessman decided should be covered. And you don't have insurance. So it annoys me when people call it insurance. Equally annoying is when they call Medicare or Medicaid insurance, but that's another conversation. But the bottom line is, with the Affordable Care Act, they came up with a way to make everybody have access to some kind of insurance coverage. And the biggest scam of the insurance industry has always been not covering pre-existing conditions. And you can't get mad at a businessman for not wanting to pay for something that happened while you were under the coverage of some other businessman. So the concept of pre-existing conditions is a difficult one. And by forcing everybody to pay, forcing everybody to cover you, whether you had a pre-existing condition or not, made it possible for people who could otherwise not get insurance to get insurance. Now, the reality is, in their zeal to get rid of Obamacare just because it has Obama's name, they keep saying that they're going to maintain your ability to have coverage for pre-existing conditions. They have no clue how they're going to accomplish that. They've been promising a plan for 4 years. It does not exist. If it existed, there's people smarter than the people talking about it that would have said something about it by now. Now, the reality is the same people saying they're going to protect your pre-existing condition coverage, they're in the Supreme Court as we speak trying to make all of Obamacare unconstitutional because they successfully removed the tax, which was the essence of Obamacare by those advocates. The essence of Obamacare was everybody either had to pay or everybody had to play. And when they removed that mandate, then they said that the whole law is the new argument, therefore became unconstitutional. So if that gets through the Supreme Court, Obamacare is dead. Now, the reality is, if you look at what Obamacare was meant to be, and if you look at what I think should be, and that's the Medicare for all, you really have an understanding of why the private health insurance is not so good. And I could really summarize this whole talk with 3 sentences. Obamacare was not so bad. I'm already speaking about it in the past tense. I could also say traditional health care insurance is not that good, and I'll explain why in a minute. And thirdly, Medicare for all would be better. And the most important point I want to emphasize is self-pay does not equal indigent, okay? For years, the mentality, decades, in most healthcare provider circles, you go to an ER or you go to a private office or you go anywhere they're used to billing insurance companies for a living, and when someone's a self-pay, it's assumed that they're indigent. But self-pay now means intelligent, in my words. If you look at what people are paying for insurance coverage, it's not rare for someone to spend $1,000 a month or more for healthcare premiums. And it's not rare for someone to have a $2,000, $5,000, or even $7,000 a year deductible. So with $7,000 as a deductible and $1,000 a month in premiums, that's what? 7 plus 12 is $19,000 you spend long before you have a nickel coming out of the pocket of the insurance company. That's a total scam. How many people actually receive $19,000 worth of care every year? Not very many. Now, if you get sick enough to be in a hospital, or if you're on a bunch of expensive drugs, then it becomes a good deal. But the reality is, when we look at what comes out of your pocket and what comes out of the pocket of the insurance company, health care coverage as we know it is not a good deal. Now, what I want to stress though is the reason Obamacare got passed was they removed the mandate that was also in what Hillary Clinton was trying to promote, and that is they wanted to have a mandate that people have to take what would have been Hillary Care as a condition of licensure. That's why she was not successful in pulling off that recommendation. They didn't change a whole lot from Hillary Care to Obamacare except removing that mandate. And I think that when people have the option of paying for the service that they want or need directly to their provider without the government or any insurance company or any other third party involved, that's the American way. And I think that needs to be the option. Now, yes, everybody needs some kind of coverage for basically unexpected, catastrophic kinds of illnesses. I think everybody should have some kind of coverage if you are likely to have some kind of chronic illness and you need frequent evaluations or medications or lab workups or x-rays. Everybody, it should be a right and not a privilege. But the people who were advocating Medicare for all did not do a very good job of explaining what they were trying to accomplish. I'm not a fan of the government running anything, okay? But Medicare for all would have been a whole lot better than what we have now. It would have been better than the private insurance. It would have been better than Obamacare. And when everybody's covered by the same source, single payer, all that does is eliminate the rich cats getting all of your premium dollars, okay? The insurance industry and the bank industry have never had a recession when the rest of us were scuffling and suffering from all the realities that we've experienced in our society in the last 10 years. But when we have a way for basic services to be covered and we have the option, the real option should be you pay for it yourself. We learn a little sense of responsibility. And for a whole lot less money than you're spending in premiums, plus deductibles, if you're paying your provider, and I don't like that word either, but if you're paying your provider directly for the care that you're receiving, you still have a lot of money left over for the average healthy person, which is the majority of the population. When you compare what you would have spent on insurance and you expect the provider of your care to eat the deductible and not bill you for what the insurance doesn't pay, and you expect the world because you're paying through the nose in premiums. But the reality is, if you are paying that money to your provider instead of paying it to an insurance man who doesn't care about you, you'd be better served. So I say that to say the option they need to add to Medicare for all is the option for people to pay for services if they want it. Thank God we have that option now, because my whole practice is people who I only work for. I don't work for the government. I don't work for any insurance company, so I can stand up here and say these things without having to worry about them taking something out of my insurance check. They can keep my insurance check and spend all $0 wherever they want to. But the reality is, as long as I make my patients happy, as long as I provide them with the service that they need, as long as I identify what they want, if it's not bad for them and it's not going to hurt them, and if it's something that's not good for them, it's my job to talk them out of it. So bottom line is, people need to understand what they're paying for. And if you're paying for an insurance company's profits, don't expect it to be in your best interest. If you're paying your provider to provide you with a service, you're entitled to get your money's worth. So yes, there needs to be some basic coverage. Yes, there needs to be some coverage for everyone. And yes, we need the option of being responsible citizens to do the same things we do for our automobiles, our clothes, our food. You don't expect the government to provide your dinner, and yet, if you're unable to afford food, there is such a thing as food stamps. Okay, so you need the option to spend your money the way you want to spend it, and thus I am an advocate for things like medical savings accounts. But it makes no sense for a disinterested third-party fat cat on Wall Street to tell you or your doctor what you should have in the way of health care. That's just unintelligent. And it makes even less sense for us to spend these huge premium dollars and have these huge deductibles and never receive that amount in service. Makes no sense. So anyway, here we are on the eve of Obamacare. Whatever it gets replaced with, I hope somebody will keep these ideas in mind as they redevelop whatever kind of system we're going to have in the future. And indeed, if I were to point to the one mistake, not one, but the biggest mistake that they made when they developed Obamacare, they had a room full of politicians, people from the insurance industry, and people from the pharmaceutical industry, and the politicians drafted it. Those other people signed off on it. Nobody was in the conversation who took care of patients for a living. And the deficiencies and the fallacies and the reason it has failed is almost exclusively on that basis. Those mistakes would not have happened if people who take care of patients for a living were involved in the conversation. So as we mourn the demise of the Affordable Care Act, I hope as we develop something to replace it, somebody keeps these ideas in mind. Thank you for your attention. I look forward to the opportunity to address concerns that you bring to my attention by sending me an email at info@wisemedicalcenter.com. Thank you.
Dr. Locke addresses current events as well as important medical issues using responsible, unbiased journalism approached from a medical perspective. We invite you to submit questions or comments or suggestions for future topics by email to info@wisemedicalcenter.com. Again, thank you for viewing the Wise Medical Minute.